Hey everyone, thanks for tuning in to watch this video. My name is Dr. Akash Kapadia. I'm a urologist practicing in the Atlanta area, and I specialize in men's health issues. To learn more about me, you can Google search my name or go to kapadiamd.com. In this video, I'll be talking about one of the other issues that affects men's health, and that condition is called Peyronie's disease. Peyronie's is actually a fairly common condition affecting up to 10% of men in their 5th and 6th decades of life. This is a condition that results in scarring or fibrosis of the penis. Clinically, this presents as men having significant deformities to the penis in the form of bends or curvature in the penis, as well as loss of length, narrowing of the shaft of the penis, or loss of girth in the penis. This can also cause pain during erections. This condition may also result in loss of firmness in your erections. In truth, the cause of Peyronie's disease is actually poorly understood. It is true that Peyronie's can be genetic. In other words, it can run in families. It's also true that some men describe significant traumatic events to the penis that then resulted in curvature after sexual intercourse. But for the most part, we don't know the cause of Peyronie's. Many of us in this field do think that this may be associated with microtraumas that happen to the penis. In other words, the normal wear and tear that happens in the life of a man. So Peyronie's disease can have a very significant impact on intimacy for couples. For starters, in the early part of the disease, men may experience severe pain during erections. Over time, couples may also find that they experience a lot of pain during intercourse. This makes it difficult for them to find a comfortable position during sex, ultimately making the whole process less organic and natural. Many couples actually also experience difficulty having any sex at all. And finally, because the scar tissue replaces natural tissue in the penis, men may also see that their erections are weaker than they used to be. So Peyronie's disease is a clinical diagnosis, meaning I can make the diagnosis based on my physical exam, during which I may find scar tissue or plaque in the penis. Many men will also present with pictures of their erections that helps me see the nature of their curvatures or penile deformities. In many cases, my colleagues around the country and I will perform a specialized ultrasound study called a penile Doppler study. This study helps us identify a few things. Number one, it helps us study the blood flow to the penis, understanding a man's erectile reserve. Number two, we're also able to visualize the scar tissue or the plaque within the penis on this study. And number three, it also helps us understand the nuances of a man's penile deformity based on an artificial erection. There are a variety of medical and surgical treatments for Peyronie's disease that have been tried and tested over time. What men should know is that there's only one FDA-approved medical treatment for Peyronie's disease. That is in the form of an injection therapy called Xiaflex. Xiaflex is an enzyme called collagenase, which helps break down the scar tissue or the bad collagen. Other than Xiaflex, there is more emerging data on adjunctive treatments such as penile traction devices that may be helpful in improving curvatures in men. Finally, there are a variety of surgical options that may also be corrective for many men suffering with Peyronie's disease. So I take a very individualized approach when it comes to treating a man with Peyronie's disease. Oftentimes, what will determine the course of treatment is the erectile reserve that the man has, meaning the quality of erections he's currently getting at the time of his diagnosis. Nevertheless, my job and my goal is to always offer men every single viable option that they have that would be a good fit for them, and then help them choose the right treatment course. You know, Peyronie's is one of these things that doesn't really get better on its own. In fact, in some men, this may actually progress or worsen the curvature or penile deformity. So my general advice to any man that thinks he may have Peyronie's disease is that he sees a urologist who specializes in men's health. These are the type of urologists that may be able to offer you early interventions that may actually change the course of the disease.